It's just about 19 minutes after the hour of 6 o'clock, and this is your Spotlight. And now I'm Kimberly De Souza. Now, last week, Friday, the Environmental Management Authority would have categorized our air levels as being unhealthy. So, to delve a bit more into what exactly is unhealthy air levels and how we could avoid it, I have on the line with me the Assistant Manager of Technical Services at the EMA. I have Ms. Giselle Joseph. Ms. Joseph, good morning, and thank you so much for joining us on Now.
Good morning, and thank you for inviting me this morning.
Now, we've been hearing that the air levels in and around Port of Spain have been, that has been categorized as unhealthy. And of course, this was based on a reading by the Air Quality Index. So first of all, what is the Air Quality Index?
Well, the Air Quality Index is actually a number that is used for reporting the daily air quality. It's really based on concentrations of the air that we measure at specific locations, and it's used to calculate an overall index that ranges from 0 to 500. There are 6 different levels that can be reported within that scale of 0 to 500, ranging from good and moderate up to very unhealthy and hazardous. And that air quality is usually reported to give the public an indication of what they may be breathing in at that point in time, at that specific location that it is being measured. We usually measure, we have currently 4 stations on the AQI index, one in Port of Spain, one in Point Lisas, one in San Fernando, and one in Tobago. And the air quality index that is reported at the time is based on a specific pollutant that may be being measured at the time that the AQI is recorded. So in Port of Spain, today it's actually recorded as moderate, which is acceptable. However, in terms of moderate, usually there's a small number of the population who are highly sensitive to air quality that may have a response, but usually moderate is still good for the general public. Last week, when it would have been recorded as unhealthy, it would have been an indication that everybody may begin to experience some of the symptoms associated with respiratory responses. So you might notice that, you have responses in your sinuses, in terms of coughing, depending on how polluted the air is. And usually we try to recommend that persons stay out of the area as much as possible, especially those who are highly sensitive, which is, of course, the very young, the elderly, and those with respiratory ailments.
Right. Now, Ms. Joseph, what would have caused the air levels to be categorized as unhealthy? Was it as a result of the Beetham landfill, or were there other issues as well?
Yes, it was primarily due to the fire that would have been taking place at the landfill and the smoke that would have been generated. Our station is actually located very close to the landfill, so we would have been picking up the very high concentrations that were being generated from the landfill. However, of course, we know that we were also experiencing some Saharan dust events, which would have contributed. But what we do is we look at the other stations located throughout the country to see whether they are having the same response as the one in Port of Spain, which they didn't. They did record moderate levels. So we knew that primarily the contribution at that time would have been based on the discharges from the landfill.
Right. Now, you mentioned in terms of the AQI, there's a 0 to 500 range, and there's something that's called a moderate level. Is there like a figure we can say, well, this is moderate, this is healthy, this is actually unhealthy?
Yes, so the scale ranges in each level, and usually if you look at the AQI as reported on our website, you will see a number assigned. So it will tell you that it's moderate, but there will also be a number that is reported. So for the good range, where everybody is great, nothing to worry about, air quality is completely satisfactory, that's from 0 to 50. Then when we move to the moderate category, the levels will range from 51 to 100. For the unhealthy, and well, there's an unhealthy for sensitive groups category, and that ranges from 101 to 150. Unhealthy would range from 151 to 200. very unhealthy, 201 to 300, and what we consider hazardous from 301 to 500. So there's a scale, and if you go on the website, you will see the scale as well. We have information on the AQI index, but in terms of the actual reporting, you will see a number given for that particular location at that particular time.
Ms. Joseph, were we ever in a situation where we hit that 300 and over mark?
There was a couple instances where it spiked, and usually it would have been based on the changes in the wind conditions at that point in time. We ensured that during those times we would have been in communication constantly with the Ministry of Health, but we would have been reporting those levels so that, you know, any necessary actions to be taken can be. And we were monitoring to make sure that not just the AQI, because we also have, you know, reported concentrations directly to us. So we look at the standards as specified by the EMA in our air pollution rules. And we look at the fluctuations to determine if it's consistent or if it's something that is, you know, fluctuating based on, as I said, the weather conditions. So based on those different factors, we would have been reporting to the Ministry of Health, as well as I believe we also looked at discussions with ODPM, but we were primarily communicating to all the relevant stakeholders so that any decisions to be made can be made.
Now, Ms. Joseph, earlier you mentioned some of the people who might be vulnerable to this type of unhealthy air quality. So people who have allergies, those who have, you know, respiratory illnesses and so forth. But, you know, how can we protect ourselves if we're ever in a situation where we're experiencing, you know, this unhealthy type of air or this unhealthy quality of air?
Well, we tend to give general recommendations. So if you go to the website, it will tell you, okay, unusually sensitive groups should consider reducing prolonged heavy exertion, because of course, when you do more physical activity, it increases the responses in your respiratory system. So during that time, we would tell you, stay away from any physical activities, try to stay out of the area where the pollutants may be generated depending on the levels, or if you can, leave the area. And of course, you know, ensure that you're in an area that, you know, the air is circulating so that it's not as concentrated in your particular location.
Right. Now, Ms. Joseph, I was just wondering, are there any adverse, you know, effects to being exposed to this type of air quality, you know, over a long period of time?
Well, yes. If you go to WHO and their guidelines for air quality, they actually discuss in detail some of the health effects. For example, in terms of the particulate matter, well, there's two different levels. You have the coarse particles, which is the particulate matter between 2.5 micrometers and 10 micrometers, and then the fine particles, which we monitor both levels. And in terms of these pollutants, they can aggravate the respiratory conditions that you may already have, or stimulate some of those respiratory responses, such as asthma. In terms of long-term exposure, you can have long-term health effects because these particles will lodge deep in the lungs. So in terms of respiratory, serious respiratory illnesses, and depending on the length of exposure and the high levels of concentration, which would be over a very long period of time, it can result in, you know, things like cancer as well. So it's very important to pay attention to the air quality so that you're not exposing yourself to that type of those types of levels.
Now, Ms. Joseph, we usually measure the air quality levels in different parts of the country. Is there one particular area that might be, you know, more unhealthy than others?
We haven't observed that based on our measurements. In general, the air quality is actually very good in Trinidad and Tobago, except of course when we have Saharan dust events, and but for the most part, if you follow our AQI every day, we generally on a majority basis register in the good category, which is good air quality for everyone. There's no one particular area, and like okay, so based on where the Port of Spain station is located, we will notice fluctuations in the levels. It's still good, but we notice the increase during specific times of the day. So like peak traffic time where you have a lot of traffic in the area and the vehicles are generating emissions, we will notice an increase during that time. And then of course it drops to very, very low until the peak traffic time in the afternoon again. So we observe those types of trends at specific locations, but there's no one location that actually stands out with respect to their air quality being, less than satisfactory.
Right. Now, Ms. Joseph, in terms of the Saharan dust, I know there's not much we can do about it, but what else can we do, or what can we do to, prevent the air quality levels from being so unhealthy?
Well, we can't really, do anything about the air quality itself, but, we can certainly try to protect ourselves wearing masks to help minimize the amount of dust that we inhale. And of course, as I indicated before, to not exert ourselves, not to take part in too much physical activity. I know there's some people who can't go a day without it, but, sometimes you just have to exercise that caution during the period of time to minimize those impacts to yourself and ensure that you're not exposing yourself to any serious conditions, especially since we have a prolonged period of time during the year when we do experience these Saharan dust events, and we're actually approaching the time when it tends to be more frequent and more intense. We want to make sure that persons are constantly aware and making sure that they protect themselves as far as they can under these circumstances.
Right. And of course, based on the current AQIs, we seem to be back to normal at this point.
Yes, for the most part, we do recognize that for most of the stations we're at moderate, so we're now monitoring to see if we are having any Saharan dust levels in the air. As I said, typically we would usually fall within the good range. So once we see moderate, we tend to look at conditions in the area and whether or not we're having a Saharan dust event. But still, as I said, for moderate, these levels are still acceptable. Of course, the very, very unusually sensitive groups are the ones that may have a reaction.
Right. And Ms. Joseph, there has been, some conversation about the type of mask that you can wear. I mean, when we see that the air quality levels are unhealthy, can we wear the mask? And if we are wearing the mask, is there a certain type that we need to wear?
Well, in terms of the masks, typically we would what we would call the dust masks. Those are the ones that are designed to actually protect against the impacts of dust. Remember, we're measuring particulate matter in the level at the levels of 2.5 micrometers and 10 micrometers. So they are inhalable. So any mask that will prevent you breathing in those levels, those size particles, will be acceptable and useful in terms of protecting against the dust levels.
And finally, Ms. Joseph, there was a website that you mentioned that we can go to get more information. Can you just share that with us, please?
Yes, you can actually go to our website. The EMA's website is www.ema.co.tt. And when you go on our website, you can go to the air page, and the AQI dashboard is on the air page. Once you click on it, the full details of all the stations come up, and you can see from starting from Point Lisas going down to Tobago. And pretty soon we will be adding Arima to the list. We've just installed the station and we just have to complete commissioning, so the public can look out for that soon. And you can, check the air quality in the particular area closest to you where we may have a station. And we continue to expand the network. So as we go along, you may see stations coming up in other areas. We do have one planned soon for Point Fortin as well, so the public can look out for that.
Nice. Ms. Joseph, thank you so much for, coming on the Now Morning Show and just explaining exactly, what, for example, what is the air quality index and, how we can protect ourselves from these unhealthy quality air levels. So thank you so much.
Sure. And if persons want further information, they can also visit our website as well. We do have brochures and other resources. We do publish as well quarterly air quality reports on our website on the same air page, so they can go and take a look at that as well.
Great. Thanks a lot, Ms. Joseph. Have a good one.
Thank you for having me.
And that was Ms. Joseph from the Environmental Management Authority, just sharing with us some stuff about the air quality levels. You're on the Now Morning Show. Up next, we have Ayenka Will with poet and spoken word artist, Ms. Zakia Gill. Stay with us.